Vaccines and vaccine equity remain a critical issue in global health. Vaccines have transformed global health, saving millions of lives. Yet, access to these life-saving tools remain unequal, leaving vulnerable communities at risk. Hello and welcome to this CNBC Africa special. I'm Renuka Methil, and joining me to explore matters of vaccine equity and what it takes to ensure that everyone, everywhere can benefit from immunization is Dr. José Manuel Durão Barroso, the chair of the Board of Gavi, the Vaccine Alliance. Welcome, sir. So nice to have you here with us in the studio. We are a day to the G20 summit, but I'm going to talk about the G20 summit. I'm starting with that primarily because of your association with the first black president of South Africa. The first chair of Gavi was Nelson Mandela. Let's start with that memory of your first meeting with him.
Yes, in fact, that was one of the arguments when I was approached to lead Gavi as chair of the board, was that the first president of Gavi, what will become Gavi, it was the vaccine fund, has been Nelson Mandela. Nelson Mandela was probably, he was the person in politics that I admired the most during all my life. I had the honor to meet him several times. I met him the first time in Namibia, the day of independence of Namibia in Windhoek. It was some months he had been released from prison. He was not yet president of South Africa. Afterwards, I met him several times. In fact, I'm from Portugal. I was at that time deputy foreign minister, and then I became foreign minister, and our president and prime minister invited him to visit Portugal. So I remember hosting him in Lisbon in 1993. And afterwards, we had many contacts. So, and for me, when some people ask me, you have met so many important leaders during all your life, what was the one who impressed you the most? I always say Nelson Mandela, because that was true charisma. Today, people speak about charisma in a way that I don't agree it's charisma. It's marketing.
Right.
It's people that are great communicators, some of them, but charisma, we feel it when we are with someone that really inspires others and is able to make decisive changes. So that was one of the reasons why I accepted to chair Gavi. It was during COVID in 2020. And I think it's a great mission, because there is nothing more important in life than saving the lives of children. Is there anything more important? I'm sure.
It's the most cost-effective intervention to save lives and actually improve economic progress of countries.
Exactly. That's exactly why I've accepted this, and I'm now very proud of what Gavi has achieved over the 25 years of its existence. According to independent reports, we have helped to save at least the life of 18 million children, most of them in Africa, because most of our action is in Africa, but we are all over the world. And also, in doing so, we are giving a contribution, of course, to public health, because vaccination is the first point of entry of a baby in the system of health. It's usually are the mothers, not the fathers, I have to say. Usually the mothers who bring their baby to the vaccination, and that's afterwards the first contact with the public health in the country, and afterwards, of course, to build more resilient health systems, and also, as you said, to support the economy, because a more healthy population makes also a more prosperous economy, and also to support afterwards through many ways the growth in our different countries.
So great to have you on South African soil. You referred Mandela. This is Mandela's Rainbow Nation. We have 20 countries, 21 entities coming here for the G20. Now, if we were to look at hard numbers, we know that Africa has this goal of producing 60% of vaccines locally by the year 2040. Now, forums such as the G20, how do you see that accelerating that pace? We're talking about the G20. Are we also talking about the generosity of governments to sort of accelerate and ramp up vaccine distribution and equitable access in Africa?
Look, I think the G20 should devote time to that. I think that's a matter where, in principle, there should be no divisions, because, let's be honest, there are political, ideological divisions today in the world. The world is very much fragmented and polarized. But when it comes to the lives of children, what it matters if you are American or Chinese or African or European. I mean, I'm now saying that as a father and a grandfather.
Yeah.
So, I mean, there is nothing more important. So I hope that even if there are some disagreements, and I know there are some disagreements, the leaders of the world, the G20 leaders, they commit to continue to support immunization, and not only immunization, also public health in our different countries, namely those who are still behind, because it has been sometimes very unfair to Africa,
yes,
as we have seen during the COVID pandemic. So I hope it will be some progress. Speaking now more specifically about Gavi, we were successful, I believe, in our replenishment for the next 5 years. Mm-hmm. We are very grateful to the European Union. We have organized in Brussels the pledging conference. But honestly, I have to be very sincere. Sometimes I joke I'm no longer in politics, so my sincerity now is total. So I can speak independently. The reality is that there is a decrease in development aid. Mm. So the traditional donors are not so committed as they were before, because they have difficulties with their fiscal space. For instance, in Europe there is a war going on, and that's why we need to find new ways. So enlarging the donor basis, asking new countries to come and join the traditional donors, also to mobilize more the private sector, also to be more efficient the way we deliver development aid and specifically now public health support. So it's a challenging time for development aid in the world. So that's why I would like to see, now as chairman of Gavi, this G20 here in Johannesburg in South Africa recommit to the ambition, namely what you mentioned about Africa. I think it's a very ambitious goal, but I think it's feasible. In fact, one of the reasons I came here was that I'm meeting the government of South Africa. I already met Minister of Science and Minister of Industry. Tomorrow I'm going to meet the Minister of Finance, the Minister of Health, to see how we can support South Africa that is already leading. Mm-hmm. Because South Africa already has some manufacturing capabilities in vaccines, how we can make sure that South Africa and others benefit from AVMA. AVMA is the African Vaccine Manufacturing Accelerator that was created by Gavi, $1 billion US, and we can support the manufacturers, provided, of course, they are able to produce at quality. So according to the qualification rules of the WHO, the World Health Organization. So, and my assessment is, very honestly, is that there will be capabilities that are ready for support in South Africa and also in other countries. I cannot commit precisely because it depends on them, but our assessment is that we see progress in Africa in terms of building local capability for manufacturing, which is good, of course, from a vaccination point of view, but is also important for the industry and developing also technology and science and new jobs. I think this is very important for the economy.
This all sounds very promising, sir. I mean, and obviously you're perfectly placed for these kind of engagements because you've been the president of the EU, you've been a former minister in Portugal, so you sort of understand how regulatory environments and governments work. So I hope it happens. But I'm just going to refer to one of your recent reports that says that in 2024, Gavi-supported vaccines saved a record-breaking 1.7 million lives, and this is 400,000 more than in 2023. That's your annual progress report. Are we going to see any great numbers for 2025? I
hope so. we are now. I have to be very open. We are now in a more challenging environment because we have less money than what we would like to have to do it. Having said that, I think that with some economies, more efficiency, and trying to bring in some new donors. For instance, I was recently in Indonesia. Indonesia until now was just receiving as a beneficiary country. But now, understanding, I met the president of Indonesia, and in an improvised press conference, he announced $30 million US as contribution. Sure. So it's great. So we have countries, not only the traditional G7 plus countries, but also so-called emerging economies that are already contributing. And South Africa has already committed in the past 20 million for the International Financial Facility immunization. We'd like South Africa to continue because it's not just about receiving, it's also to be part of the decision to be at the table of decision making. It's very important. It's also about the dignity. It's not just about money. It's about the dignity of Africa, to be present not only as receiving support, but also shaping the decisions.
Shaping the decisions.
And this is we are very committed to that, and I think today the direction of travel is clear. My honest answer to you, I'm not yet sure that we are going to fulfill all our goals, because we are indeed acting in a very challenging donor development.
Right. So it's prioritizing Africa and making sure that Africa is on the table making these decisions. Because I think some of the nuances that we have in Africa are very unique to Africa, because these are communities where you need to sort of build the trust for immunization programs, for example. You mentioned malaria earlier, and this is the biggest cause of death in Africa. So I think that kind of cultural understanding and nuance is also important. But can you just take us through some of the goals in working with these governments? You know, you mentioned manufacturing in Africa, in South Africa, but what about some of the smaller countries where you have some of the more vulnerable populations or low-income emerging economies?
Look, let me tell you very frankly, today I find sometimes more vaccine skepticism in some of the developed countries, the richer countries,
sure,
than in Africa.
Right.
In Africa, people see that when they have vaccines, they save the lives of children. For instance, there is a huge support and demand for vaccines against malaria in Africa. It comes from Africa.
Yeah.
But sometimes in some of the more developed and sophisticated countries in the world, from an economic point of view, probably because they have not known recently, for instance, measles. Measles practically does no longer exist in Europe or in North America. People are not so much used to it, so there are now a series of conspiration theories, misinformation against vaccines.
Yeah.
So it's quite interesting. In Africa, sometimes people don't have the information, but generally speaking, at least at leadership level, for instance, South Africa, your president has been one of the champions for vaccination,
yes,
designated by such by the African Union. So, in fact, we have more demand from developing countries than from the richer countries. So I think it's an important point. To make the point in terms about science, okay, I personally, I'm the chair of Gavi, but I'm not an expert in this or that vaccine. And that's not. So what we do at Gavi is to rely on the best science available by the most advanced regulatory and scientific institutions in the world, and only to distribute the vaccines that we believe are safe and efficient, of course. Right. That's important.
And affordable. You've got to make it affordable for...
And that's what we have been doing, by the way. Thanks to Gavi, we have been lowering the price of vaccines because we are one of the biggest buyers of vaccines in the world. So, in fact, what Gavi does is the procurement, together with our friends from UNICEF, by the way, they are part of the Gavi Alliance. Yes. And what we do is we can only buy vaccines if they are at the best possible price, and we negotiate a price that is the most affordable to the developing countries. And in fact, in some cases, we offer them for free to the developing countries.
You mentioned the alliance, so even the Gates Foundation is a part of the alliance, and they're doing a lot of work for child mortality, preventing child mortality and deaths, and also HPV vaccines, as I imagine. So what is the kind of progress on that?
No, it's amazing. Yeah. We are very happy to say that now there have been extremely good news also on the distribution of HPV vaccines. So we are saving also the lives of millions of young girls, young women and girls. And that is also one of our priorities for the next period, so HPV. And by the way, another area where we see huge demand coming from Africa. So what we need from Africa, the problem is not to have demand from vaccines. The problem is to have sufficient response and sufficient funding. Yeah. And with time, I think, and it's going to happen, we'll have more successful cases of vaccine production here in Africa. In South Africa, I believe it's going to happen now, but even in other countries of Africa.
But it's not just the production, really, is it? It's also manufacturing. It's a last mile distribution. It's cold storage. It's distribution. Yeah. So how do you see this all evolving and developing?
Look, I usually say that that vaccine is not a product. Vaccine is a process.
Yes.
It's so
yes,
complex
that's a beautiful
because
way
you
of
have
saying
to have
it,
the
yeah.
science to produce it,
Yes.
the clinical science, and there is great research going on. But afterwards, you have to have the capacity to distribute it, to reach what we call the zero-dose children, those that have never had the opportunity to have a vaccine in the most remote parts of the world, not only developing countries, but sometimes even middle-income countries, but they have, let's say, poverty around their important cities and so on. And that's why it requires to have the science, the technology,
Yes.
but also the logistical capabilities, what you mentioned, the cold chains,
Yes.
and also to have the social support to make it, and the societal support to make it happen. So it's a very complex process. But basically, if you look at, compare the situation today with the situation, let's say 10, 20 years before, it's much better.
It's much better.
Many more people have access to vaccines, and Gavi has been giving a very important contribution. It's a very successful case of public-private partnership, because it's, of course, the government support, but also you mentioned Gates Foundation is one of our founders, together with WHO, with UNICEF and World Bank, but also with the private sector, not only other charities, but also the private sector that is increasingly also committing to this goal.
So it's the holy triumvirate, really. It's government, it's private, public support.
Exactly.
And so, you know, we have the African Continental Free Trade Area Agreement working towards trade and making Africa a single market. So how does a concept like that help?
That concept is ideal, but to be very honest, we are still not there.
Not
that's there. While in Europe, the European Union, with all its problems, but in fact there is an internal market for goods without tariffs among ourselves, without quotas. In Africa still, and this is one of the important issues. I think Africa should invest more on the pan-African solutions. Now I'm speaking as someone who is of course not African, but I've been working with Africa since the 80s.
Since the 80s.
I visited 35 countries in Africa, so and some of them I know relatively well, others not so well. And for me, one of the important points about Africa is Africa has a lot of great things. I mean, the young people, you are the most dynamic continent in the world from a demographic point of view. Yeah. The energy, the enthusiasm, the creativity, the resilience of the people. But it's still lagging behind, let's be honest, in some matters of governance and institutional consolidation at African level. So the African Union is trying to do their best, and they make a lot of progress. But in fact, there is still something to do in terms of institutional creation of African unity frameworks. Yeah. But for instance, I want to say that I've been working also, we have been working as Gavi with CDC Africa.
Okay.
And with African, and we have seen real improvement and more commitment. And the Africans are now really much more assertive in trying to have a global voice, and that's part of the reason why we created, together with the Africans, is AVMA, the African Vaccine Manufacturing Accelerator. So that to have a more equitable world, also in the field of immunization.
So you mentioned financing earlier. So let's talk innovative financing or blended financing. How do you see these new models coming to the picture, to the party when it comes to vaccine equity?
More than ever, they will be necessary. Yeah. By the way, Gavi itself was innovative in that matter. We created IFIM, is International Financial Facility for Immunization. That is a very smart way of, it's a kind of vaccine bonds. So the countries, some of the countries, they cannot commit immediately, let's say 20 million or more $million, but because also of their budget constraints, but they can commit over time, over 20 years. And so, and they know, they commit and they can receive an interest over time. That is some kind of reward, compensation for their capital. And it's working. IFIM is working. It was a creation of Gavi. So, and today with the difficult fiscal constraints we have, including in the developed world, I think we need more innovative financing and more mechanisms of financial engineering that are, of course, sustainable over time. That's also a way of having countries that are not the traditional donors to come to the table, as we are seeing now. And yes, because of the current situation, there will be more solutions based on innovative financing.
And with all of the climate change around us, there are obviously climate-driven outbreaks now. How prepared are you for that?
That's what I mean. That our main goal at Gavi, of course, is immunization of children, and I always try to focus on our mission. But of course, this is related. We are seeing climate-related diseases, including contagious diseases, going up. An example, dengue is now. We have more cases now, so it's a fact. There are some people that still discuss. I mean, that's a little bit ridiculous to discuss with the reality, to discuss with the facts. This is a fact that climate change, also because of the harm it's making some habitats, is making it easier for some contamination and the spread of some diseases.
Yes.
So that's part of that's one of the reasons why I believe, as I said earlier about G20, that when it comes to these global public goods, it makes no sense to have to introduce political or ideological barriers or polarization, because climate change, by its very nature, it's something that we can only fight if we are together, because we are on the same planet. It's one of those cases where we cannot say your part of the boat is sinking. Yes. So we need cooperative efforts globally. Yes, and I hope that we can find again that spirit in G20, because sometimes I'm not so confident that there is the real political will globally to address those global issues in a collective, multilateral spirit.
All right, are we prepared for the next pandemic? I mean, what are the learnings from the last one?
We are better prepared, but if you ask me, we are not completely prepared. The last pandemic, in fact, it was amazing that even the most developed and rich countries in the world, they were not prepared.
Yes.
They were, while the science was much better than politics, to be frank.
Oh, that's
the scientists developed in a record time new vaccines, mRNA vaccines that were developed in record time, but the politicians took some time. And in fact, while everybody knows in terms of risks, all governments, and I was Prime Minister of my country, and besides being President of the European Commission, all governments have a kind of a risk management. So they know that pandemics can happen, terrorist attacks can happen, climate-related events. So that's a risk. It's natural catastrophes. But about pandemics, they were not ready. Even in Europe, we did not have the basic personal protective equipment like gloves or masks. We did not have that. So now there is an effort all over the world to be more resilient and to be prepared. Having said that, for instance, the pandemic accord, there was an agreement in principle, but not completely. There is still the annex that should be approved. So my honest, open answer to you, yes, today we are more aware of the situation globally, but I'm not completely sure that if a new pandemic strikes soon, that will have the effective response that we all would like to have.
So we've not really learned from the last.
No, to be honest, some lessons were learned. Part of it, by the way, AFMA, I think, is a lesson learned. That's why we are now trying to get, I mean, the Africans themselves, but also with the support of others, including Gavi, we are responding. So some lessons were learned, let's be fair, but I think I'm not sure that it is as fast and as ambitious as we should be.
All right, thank you so much, sir. I mean, what we knew from the pandemic, the slogan that we all heard was no one is safe until everyone is safe. And I'm just hoping that Africa is not left behind again in the next pandemic, and hopefully the G20 will come up with some answers for the next 3 to 5 years at least. And that's how we wrap this CNBC Africa special. I'd like to thank my guest, Dr. José Manuel Durão Barroso, the chair of the board of Gavi, the Vaccine Alliance, for shedding light on the importance of vaccine equity and the role Gavi plays in making life-saving immunization accessible to all. From me, Renuka, Methil, and the CNBC Africa team here, it's goodbye for now. Thank you.
She looks to me as a